Good afternoon, everyone. This is Alicia Munson from the ARC, Minnesota. I'm really grateful for all of you joining our webinar today. We wanted to have an opportunity to connect and discuss outcomes from the 2018 legislative session, as well as fill you in on what's next as we head into the summer and fall and really ramp up our Get Out the Vote efforts. Also looking forward to any of your questions. You can submit them through a couple of different ways. You can use the chat field through the GoToWebinar platform. Also, at the end of the call, we'll have an opportunity to unmute participants. And so if you'd like to share your question with the group, you're more than welcome to do that as well. But we will ask that folks, if you'd like to be unmuted and share your question, that we'll wait to do that to the end. But if there's anything that comes up during the webinar before then, please feel free to submit it via chat. We do have my colleague Jean Martinez here, Senior Advocate, who is monitoring the discussion field. So we'll go ahead and get started because we do have a lot to cover. Really quickly, I wanted to give some insight into the context of this legislative session. As you all may know, it was the second year of the biennium, which is traditionally a year that focuses specifically on bonding or investments in capital projects such as roads, bridges, infrastructure, etc. And one of the interesting things that we saw heading into session was some dynamics between the legislative and executive branches. So Governor Mark Dayton, of course, being a member of the DFL, the Democratic Farmer Labor Party, and then both the House and the Senate controlled by members of the Republican Party. And as you may recall, that made for some interesting dynamics because last legislative session there was some contention between the two branches about some various policy proposals that resulted in Governor Dayton line item vetoing their operational funding, and that spilling over into the summer through several court cases. So there was certainly some tension throughout the summer of 2017 that continued on into 2018 as we headed into the legislative session. However, they were able to come to some agreement. And so one of the very first things that we faced was making sure that the legislature had funding to be able to operate so that there could be a session to begin with. But once that got underway, session moved very, very quickly. Started on Tuesday, February 20th, and the first deadline by when policy bills had to move through the committees in their House of Origin was just, about a month after we first started, which is a very, very quick turnaround to make sure that we're meeting with legislators, we're talking to them about our priorities, we're having our bills introduced, and then to make sure, like I mentioned, that they were heard by that first deadline of the 22nd. That following Thursday, we faced the second policy deadline where all bills had to be heard in the other body in order to continue to move through the process and be considered quote unquote alive. And so that comes up a little bit later. There was one proposal that we were working on that did not meet that second deadline. And again, it was just challenging given how crunched the schedule was. But then there was about another month by when all of the bills had to be heard in finance committees in both the House and the Senate in order to continue to move through the process. That was Friday, April 20th. And then it was just another month after that when at 11:59 p.m. the legislature had to formally conclude their business on Sunday, May 20th. While the last day of the legislative session was technically Monday, May 21st, in the second year of a biennium, they are not able to formally take any action or pass any bills. So like I mentioned, they had to be done before midnight that Sunday, and they did adjourn the session, what's called sine die, that Monday. And a lot happened during those couple of weeks. And there were some fiscal implications in addition to the kind of political dynamics we were facing. One of the things that you may recall is last November when we were given a glimpse into the fiscal state of the state, we saw a $189 million deficit in the November forecast. Much of that was due to the fact that we were waiting on some federal funding coming through. And thankfully, when the updated forecast was released in February, we had a $329 million surplus. So advocates were a bit relieved when we saw that number go from a negative to a plus. However, in the grand scheme of the state budget, a $329 million surplus, which I know sounds like a lot of money to us, is a relatively small amount of wiggle room to work with. Nonetheless, the governor did put together a supplemental budget that had some really positive things that impacted folks with disabilities, primarily the fact that he had laid out some investments in recruitment and retention for PCAs and self-directed staff through CDCS and other options. So we were excited to see that investment outlined in his supplemental budget, as well as a couple of other things that were beneficial for folks with disabilities. However, one of the things that was surprisingly not in the governor's budget was any investment in the disability waiver rate system for home and community-based services, and we'll get into that a little bit later. Thankfully, we also received positive budget targets for key areas that disability policy is included in, so specifically health and human services. As you all know, in previous years, we've sometimes seen those negative targets, which means that leadership of those various committees or policy areas have to find savings or reduce funding in certain places. And when we saw that November forecast, we were a bit nervous that's what we would be facing. But thankfully, the key committees that we were working in had positive budget targets. So we were, from there, excited to advocate for our policy priorities that were included in our 2018 legislative agenda. And if you participated in our webinar during the legislative spring break, this format may be, you may remember it. It's the same format we used. And I thought that rather than going through the entire massive 990-page omnibus, or the bill that included many different areas of policy, and then the massive bonding bill, we would go through step by step what was on the ARC Minnesota's legislative agenda, what were some other issues that we're tracking, and give updates as we go along. So one of the items on our legislative agenda that has been present there in years past was the Home and Community-Based Services Innovation Pool. As you all know, this is a source of funding, grant funding for a variety of grantees to focus on improvements and meeting goals in three key areas in the lives of people with disabilities. First and foremost, advancing competitive integrated employment. Secondly, advancing community-based independent residential options and living situations for folks with disabilities. And thirdly, just general inclusion, making sure that folks with disabilities feel meaningfully integrated in their communities. Last legislative session, there was a temporary increase in funding of about $1 million for over 2 years. And what we had hoped to do this legislative session was make sure that that $1 million increase was added into the base rate, so that funding would be available on an ongoing basis. Specifically because youth in transition were made eligible for the Innovation Pool funds last legislative session, and that's a critical area that we believe needs to be invested in. And so we're hoping to make that ask this session. This is of significant importance specifically to the ARC Minnesota because we actually operate programs based on the large grants that are available through the Innovation Pool. You may be aware of our Minnesota Micro Grant Partnership that provides funding directly to folks with disabilities, and then our Working Life Alliance that works to advance employment outcomes for people with disabilities and raise awareness about the benefits of competitive and integrated employment for their family members. Unfortunately, because of some other funding constraints that we'll talk about a little bit later, we were not able to secure that $1 million for this program on the base. However, what was included in the final bill, that supplemental finance omnibus, elsewhere you'll see it cited as Senate File 3656, was some no-cost language. Essentially, in statute, this program is referred to as the incentive pool, but a lot of people talk about it in terms of the innovation pool. So we just wanted to make sure that this was codified in statute, that we were using the right terminology, and we did get that in there. However, that big bill is one that was vetoed by Governor Dayton for many different reasons that he stated. He stated specifically that he had some lingering concerns in Health and Human Services and other areas of this bill, which included the environment, agriculture, education, and much more. And so despite the fact that there were some great things included for the disability community that we'll continue to discuss, that bill was vetoed. We also wanted to make some additional progress this session on advancing consumer-directed community supports, or CDCS. This is an option that allows individuals with disabilities and their family members to have more control over their funding and how they utilize their funding, what types of services they access, how much they pay their staff. And there were some great improvements made last legislative session, what were called expanding exceptions. So making sure that individuals who wanted to move out of more institutional settings like ICFDDs would have an expanded CDCS budget so that they could cover the cost of being supported in more community-based integrated settings. And we wanted to this session expand that out to children and adults who wanted to move out of foster care settings, maybe move in with a family member or into their own apartment, as well as for individuals who are at risk of more significant need of service due to a crisis in their life. Also part of that was an education and marketing campaign. We wanted to see an investment in almost a PR effort to raise awareness about the CDCS option, especially in greater Minnesota. We see that utilization rates for this option are very low. And so we wanted to make sure that people with disabilities, parents and family members, as well as lead agency staff were aware of CDCS. And so we had some language there as well. You'll remember earlier I talked about those key legislative deadlines that bills have to meet in order to continue to move through the process. And unfortunately, due to some communications with DHS and not being on the same page as far as the proposal moving forward, we did not meet that second deadline. However, we have already been in discussion with some support planners and fiscal support entities and other coalition partners, and have identified CDCS as something that we really want to continue to try to make progress on in 2019. Many of you are familiar with the Best Life Alliance. Of course, this is formerly the 5% campaign. And this legislative session, we wanted to continue to make progress towards securing funding for home and community-based services within the disability waiver rate system to ensure stable, consistent HCBS services for people with disabilities, and to make sure that each individual's rate was sufficient to be able to access the supports that they needed and wanted. And so we started the legislative session thinking, as I mentioned, that we would request possibly an increase, but also take a look at making some structural changes to the way that those rates were determined. We had to quickly shift gears in about February of this year, though, when we found out that the Center for Medicare and Medicaid Services, or CMS at the federal level, had submitted a letter to the Department of Human Services indicating that some previous rate increases that had been given through the 5% campaign were considered duplicative or stacked. And so they said that the structure of those rate increases was not allowable, and that therefore they were going to eliminate 7% worth of those increases that had been made. So again, this really caused a lot of concern for advocates in the community because that 7% represents about $55 million just in the state portion of funding, and then $110 million total when you take into account the federal share of that 7% as well. So that's a significant cut to home and community-based services that are already really strapped, struggling with the workforce shortage, and still trying to provide high quality services for folks with disabilities throughout the state. So there was a lot of negotiation between advocates and our champions in the legislature in both the House and the Senate to try to minimize the impact of this 7% cut. And essentially what we settled on was something called a competitive workforce factor that would be structured in the rates to try again to alleviate that 7% cut, but develop a rate structure that CMS would not have a problem with and that they would approve. Language to try to delay the 7% cut was included in the final supplemental finance omnibus bill, and while it certainly wasn't perfect, it at least, like I said, delayed the cut temporarily, and so advocates felt like it was a solid compromise, and again, unfortunately, included in the bill that Governor Dayton did veto, that 3656. So what that means is that some individuals will see a 7% cut in their rates as of July 1st of this year. Again, that's not everyone, it's not the entire home and community-based service system, but it is some people. And then more and more folks will feel this cut if we do not find a way to resolve it. So I know that advocates are hoping that the department will work with CMS to try to find a resolution between now and the next legislative session, when we'll be able to regroup, get our advocates together, and try to advocate for a fix to this, which was a significant priority of members of both bodies in the House and the Senate. Another bill that we were actively engaged in advocating for was the enhanced rate for high needs PCA. As you may recall from last legislative session, this was previously referred to as the complex care. Essentially what we were hoping for was a 10% wage increase for trained personal care assistants that support individuals that access 10 or more hours of service per day. And really, these are folks who have sometimes the biggest barriers to identifying and retaining their staff because they require a lot of support with some of their daily needs, whether that's eating or whether that's functions of hygiene, etc. Right now, as of July 1st, individuals who require 12 or more hours of support per day, their staff may be eligible for a 5% wage increase if they go through the appropriate trainings, but that really only impacts about 800 individuals in the PCA program. If we were able to make this significant change and secure a 10% increase for individuals accessing 10 or more hours of support per day, that would impact the lives of about 3,000 Minnesotans who utilize the PCA program. So that's why we really feel like this is something that's significantly important to move forward with. That's why we were so active in advocating for it this session. And again, this is another issue that had strong bipartisan support from Democrats and Republicans in the House and the Senate. As I mentioned earlier, a PCA wage increase was included in the governor's supplemental budget proposal as well. However, because of the real significant concern and the high cost to resolving the 7% cut to home and community-based services, this is just something that we weren't able to secure funding for this legislative session. But we did work with advocates and champions to insert some no-cost language in the supplemental finance omnibus bill that would just put in statute that 5% increase that's going to be available for individuals that access 12 or more hours per day that I mentioned as of July 1st. So that was a great compromise where we felt like at least it was a foundation to continue our advocacy efforts to continue to make progress and reform the PCA program. Again, this bill, this was included in the bill that was vetoed. So unfortunately, we will start from the same place next legislative session. I do foresee this being part of the ARC Minnesota's 2019 legislative agenda. And we saw the importance of this demonstrated in the article that was put out by Chris Sears in the Star Tribune early in May, where he highlighted the stories of some young adults who, because they could not find and retain their qualified PCAs, had to move into more institutional settings, such as nursing homes. And we really want to avoid that at all costs. And we'll continue at the ARC to try to highlight some of those stories over this summer and fall, to continue to raise awareness about this crisis in the community broadly and among those running for office. Finally, you guys, I have a little bit of good news to share with you. Housing is one of those issues that when I'm traveling the state, meeting with folks with disabilities, meeting with support staff, meeting with parents, that they tell me is one of the biggest barriers to inclusion. And so that's why we've become very actively engaged in the Homes for All Coalition, which, as you may know, is a broad coalition of affordable housing advocates that represent people with mental health issues and illnesses, people living in poverty, people experiencing homelessness. And for a long time, the disability community has kind of wasn't really actively represented in their coalition. So we were happy to partner with this team that had a couple of different proposals that I'm not gonna get too deep into. Their Minnesota Housing Finance Agency proposal, unfortunately, did not move forward. Their Department of Human Services proposal, unfortunately, did not move forward. However, they had sought a pretty big amount of money in the bonding bill to preserve and invest in affordable housing. And we won. This is something that we got, you guys. So this is a significant pat on the back to everybody that was involved. Ultimately, while the full request of Homes for All of $110 million for housing infrastructure bonds and $30 million for general obligation bonds was not fulfilled, we did secure a total of $120 million in bonds, which is a huge number and really was due to advocacy work from folks throughout the state that were connected to the ARC, as well as the Homes for All Coalition. So essentially, there were about $50 million in what are called those housing infrastructure bonds that are not restricted, that can be used for a wide variety of projects. And then $30 million of housing infrastructure bonds for permanent supportive housing for people with behavioral health needs. And then in general obligation bonds, they secured $10 million for public housing options and $30 million for mental health crisis centers, essentially emergency shelters, again, for individuals that have significant behavioral health needs. So a huge win there. It was really a team effort, and we are excited to see what kind of projects are put forward to access those bonds for affordable housing. And hopefully many of them will help expand access to affordable housing for people with disabilities, direct support professionals, and more. Other issues of interest that we were tracking, high at the top of that list was special education, of course. We were really excited this legislative session to work with the Coalition for Children with Disabilities that includes PACER, MOFAS, and other organizations. And we worked on including language around non-exclusionary disciplinary practices. Students with disabilities are disproportionately removed from class, suspended, and expelled when compared with the rates of their peers who do not have disabilities. And so this non-exclusionary disciplinary language really makes sure that teachers are utilizing practices that keep students in the classroom, that help them de-escalate to ensure that they are integrated and learning alongside other students. Also in this bill was some language around parental notification. For instance, if a student had any interface with a law enforcement agent or a peace officer, that parents would be notified, and just to make sure that communication lines are open between students and the schools and their families to make sure that they're accessing the services and supports that they need in school systems. There was also a lot of discussion about the special education cross subsidy. And so one of the proposals to assess that issue was a legislative task force that was proposed on the Senate side, made up of members of the House and the Senate, to kind of take a look at special education funding and how to quote unquote, quote, reduce the cost of special education. And we were a little bit nervous about the task force, specifically because we wanted to be engaged actively in the process. On the House side, they had proposed a stakeholder work group that would have included the ARC and other partners in this effort to talk about ways to maximize special education funding, to ensure that students are have access to early intervention practices that help benefit them throughout the duration of their time in school. And so ultimately what was included in the final bill was a lot of that really positive language around non-exclusionary disciplinary practices, as well as the Senate proposed legislative task force. Again, ultimately all wrapped up into that big bill that Governor Dayton did veto. So we will be working with the Coalition for Children with Disabilities again next session to try to make sure that those non-exclusionary disciplinary practices are implemented.
Yeah.
Another high-level issue that we were tracking was the discussion around older and vulnerable adults, specifically prevention of abuse in assisted living facilities and registered housing with services. There are about 3,000 individuals on disability waivers that live in registered housing with services because they access customized living services. And so the discussion around these issues really would impact many Minnesotans with disabilities. Some of the proposals included changes to the Home Care Bill of Rights, allowing for electronic monitoring devices in private rooms. It would have established a variety of work groups to assess licensure for assisted living facilities, as well as to take a look at current statutes to prevent crimes against vulnerable abuse, which is, or vulnerable adults, which is a work group that the ARC, through our advocacy efforts, was actually proposed to be included in. However, here again, we see kind of this trend that it was incorporated into the big bill that did get vetoed. At the last second, you guys, and I mean the last 30 minutes of the legislative session, we did see a new, what's called a conference report proposed on the Senate floor. It was Senate File 799, and it included a lot of quote unquote emergency funding. So for that emergency school funding, for the opioid crisis, as well as some funding to address abuse prevention efforts. However, that bill was specifically tied to Governor Dayton signing this big omnibus, the 3656. And so when he vetoed that bill, this also went down. So I know that many advocates that worked hard on this had some mixed feelings about the outcome. And I think it's something that we'll probably hear a lot about again in 2019. One thing to be aware of that did go through were some protections for quote unquote vulnerable adults against financial exploitation that allows some financial experts and staff, such as brokers, etc., to be able to flag certain transactions that they have reason to believe may be exploitative and to put a hold on them. We heard a lot in committee about instance where someone received a phone call saying that there was a family member who was in Puerto Rico that needed several $1,000s to post bail. And so individuals with disabilities and older adults are sometimes targeted for schemes like that. And so the intention of this bill is to have another layer of oversight so that their finances are not exploited. This passed through the House and the Senate, and Governor Dayton did sign it on the 19th of May. And so you can now find it under Chapter 161. Another item that we had some concerns about, but we were neutral on was the development of prescribed pediatric extended care centers. Essentially, these are centers that would support children with disabilities, children with complex health needs that typically access complex home care nursing for up to 14 hours a day for 6 days a week. And we know that the proponents of this bill had really positive intentions. They were trying to meet the need for many children and families who maybe are in the hospital well past the point of discharge because they cannot access home care nursing, again, because of the workforce shortage in that area. They sought to get a waiver to the state plan to use medical assistance dollars to fund services in these centers. And there were some parent advocates that spoke out and just talked about the importance of preserving medical assistance funding for truly community-based services and supports. And I really think that their concerns were heard. While this did move forward on the House side, it did not move forward on the Senate side, and so it was not adopted in the final negotiations, and it was not included in the bill that was sent to Governor Dayton. Since then, some of those parents that are affiliated with the ARC have been contacted by the proponents, and they've asked to work together to try to make sure that this proposal meets the needs of families and addresses the workforce crisis in home care nursing, but also ensures that children with complex medical needs and disabilities are served in the most integrated setting possible. You also may be keeping an eye on the discussion around EVV, electronic visit verification. This is part of the 21st Century Cures Act. So it is a federal mandate that nationwide there's implemented electronic service delivery systems that track and record personal care service provision. Right now, this is primarily in the PCA program, but we do foresee that it'll expand outward from there. And so there will be additional mandates around electronic service tracking. I know that this makes a lot of folks a bit nervous as far as having some personal data privacy implications and how closely their daily life will be monitored with these systems. The Department of Human Services in Minnesota is seeking to move forward with a hybrid model that would allow providers to be able to move forward with any type of electronic system that they already have in place, as well as make them available to other providers that are minimally invasive and secured. So I think it'll be really interesting to see what this looks like when they're actually implemented. It could be as easy as a staff person just entering into this electronic system when they arrive to provide service or support, and then when they left. But it really will depend on how DHS wants to see this implemented. Funding for EVV was not included in the governor's supplemental budget. However, there is a penalty if we do not implement this as of January 1st, 2019. So advocates kind of quickly, advocates meaning in the home care field, this is not necessarily something that the ARC was actively engaged in, but put together a proposal to make sure that we would be in place to move forward with this system. We would not incur the penalty. Again, language around this was included in that supplemental finance omnibus bill that was vetoed. So I think at this point, the Department of Human Services is intending to move forward as much as they possibly can and to demonstrate to the federal government that they're moving forward in good faith to try to implement this, again, in the most minimally invasive way possible. However, I do know that there's an effort at the federal level to advance a set of bills that are bipartisan in the U.S. House and U.S. Senate to delay implementation another year to January 1st, 2020. You may have seen an action alert about this go out from ANCOR and from the ARC US today. So keep an eye out for that on social media as well as in your inboxes, and be sure to contact your elected official if this is something that you have some concerns about. I know we're running a little bit short on time, and I want to make sure we have some opportunity to get questions in. I just wanted to note that ARM had a really robust policy bill this legislative session that did end up including some proposed changes to min choices that was kind of wrapped up into their policy bill. Essentially, it would have made sure that the min choices assessment process was conversational in nature. It would have allowed a guardian or another family member who is involved in the assessment process to do so remotely, and also for individuals accessing Rule 185 case management or on a DD waiver to decline a reassessment. And also it maintained the PCA legacy assessment so that individuals accessing PCA services would not have to utilize MIN choices. Also here we saw that this was incorporated into that big bill that was vetoed by Governor Dayton. So a lot happened, a lot went on, and ultimately we didn't walk away with too many things. However, in a year like this, we need to keep in mind that our offensive victories are equally as important as our defensive victories. And there certainly were some things that we played strong defense on this session that we were able to stop with help from advocates statewide like you. So first and foremost, the constitutional amendment that had been proposed regarding transportation. This would have diverted a certain percentage of sales tax revenue on vehicle parts and sales for transportation specifically. And while we really would be supportive of a comprehensive transportation funding package, our concern with utilizing a constitutional amendment to do this is that once it's voted on, it's a done deal. And so the legislature is really tied to maintaining that level of funding for a very specific budget area. Also have some significant concern that it would divert those resources from the general fund and potentially increase competition for resources for health and human services and education and other really critical areas of the budget. Another concern we had with this proposal that it did not include funding specifically for transit projects. And so many individuals with disabilities, especially those that live in the 7-county metro, really depend on public transit in order to get around without support from other people or without support from staff specifically. So we sent out several action alerts raising awareness about this issue, talking about the concern that we had and how it would impact health and human services and education funding. This did pass through the House of Representatives. However, it stalled in the Senate. They did not have enough support. With constitutional amendments, they must pass both bodies with a 2/3 majority, and they just wouldn't have had the votes in the Senate. And so essentially it stalled on that side, and we were thankful that it did. Of course, the other item that we were really concerned about this session was medical assistance work reporting requirements. I'm sure that if you're on our e-list, you got many messages about this. This would have impacted about 20,000 Minnesotans with disabilities who access medical assistance based on income rather than their disability, and force them to complete really burdensome work reporting requirements on a monthly basis to demonstrate that they were meeting certain requirements, essentially putting their medical assistance eligibility at risk and also jeopardizing the personal and employment supports that they access through medical assistance, as well as their really critical healthcare and prescription drug coverage. So not only did this have a significant human impact, but there was also a significant financial impact. It would have been extremely costly for the state to implement a program like this, but not only to the state, counties across the state would have likely had to consider increases in property taxes to cover these costs, and many health facilities, especially those in rural Minnesota that are already strapped for resources, would have seen an increase in uncompensated costs if individuals did not have medical assistance to help cover their emergency services. But thanks to the coalition of organizations that are involved in this is Medicaid. Again, as I mentioned, advocates like you who contacted your legislators, we were able to stop this bill. Governor Dayton didn't even have a chance to veto it. So it stopped in the House Ways and Means Committee on that side, and then in the Finance Committee on the Senate side. And we are just so grateful that this proposal did not advance this legislative session. And we were really excited to see this as Medicaid described as a scrappy coalition recently in the Star Tribune. So check out that article if you're interested. We will just continue to keep an eye on this. We are proud, strong supporters of This is Medicaid and want to make sure that our neighbors, family members, folks with disabilities that access medical assistance have their needs covered. But you guys know that our advocacy never ends. Just because the legislative session is over, there is so much more to come. We are gearing up for a busy summer and fall as we monitor all of the campaigns that are going on. We prepare to support individuals in get out the vote efforts, and also as we already prepare for the 2019 legislative session. So just really briefly, I know you guys are probably keeping an eye on all of the elections that are coming up on the state and federal level. There are many, many different positions that are up for election at the state level, including Secretary of State, State Auditor, the Attorney General, Governor, House of Representatives, Senate, and Supreme Court. So these are just a few of the candidates that are running that have filed in these various races. People whose name you see with an R or a D next to them are those that were endorsed at the recent state conventions for R, the Republican Party, or D, the DFL, for those various races. And this is not even a comprehensive list of everybody that's in the running. So it really will be a busy campaign season as we race toward the August 14th primary. We just really feel that it's so important for individuals with disabilities and disability community advocates to be aware of these races, to understand who's running for office, to understand their positions on disability issues so that folks can be informed voters. And especially when there are this many open races. In the House of Representatives, all 134 members are up for re-election or election. And last time I counted, which there could be more at this point, there were 18 open seats statewide. In the Senate, we will likely see about 3 open seats, even though the Senate is not up for re-election until 2 years from now. There will be likely some special elections that will take place on election day for that. And so just be sure to try and keep up with this. I know that there are so many, such a flurry of activity right now, but it really is important to be informed and engaged. And the ARC Minnesota is oh, I'm sorry. I also wanted to note some federal offices that are up for election. In the U.S. House of Representatives, all of Minnesota's 8 congressional districts, folks are either vying for re-election, and there are 3 open seats in the 1st, 5th, and 8th congressional districts. And then at the U.S. Senate, it's very interesting. I don't know if it's ever happened before, but both of our U.S. senators will be on the ballot. So Amy Klobuchar, the incumbent in the 1 Senate seat, will go against Jim Newberger in the election, and then Tina Smith, who was completing the duration of Al Franken's term, is going up against Senator Karin Housley. So keep an eye on those races at the federal level as well. And we will do our best to help you guys keep track of all that with a strong, robust get out the vote effort. Here are some important dates and deadlines to keep in mind, but part of our GOTV efforts will include social media, electronic resources, newsletters that remind you of these key dates. We will also be putting together some materials to make sure that you are aware of where candidates stand on issues of importance to the disability community. We'll be disseminating a candidate questionnaire. Additionally, we'll be hosting a series of voter registration drives to make sure that people with disabilities and members of the community are registered to vote and are able to participate in the election. And then, of course, be hosting a series of events throughout Minnesota as well. I just wanted to highlight that we are working with a strong coalition of folks to host a gubernatorial candidate forum later this fall. But one of the things that we're most excited about is the opportunity to participate in what's called a Rev Up campaign. This is a national effort that's put on by the Association of American Association of People with Disabilities. Thank you. I had to lean on my friend Jean here to help you remember that acronym. You guys know there are so many. But essentially, a Rev Up campaign brings together disability service providers, advocacy organizations, protection and advocacy organizations to make sure that we are sharing information with people with disabilities to be as informed as possible heading into election. And Jean, did you want to say anything else about the Rev Up campaign?
Well, we are doing outreach to quite a number of disability organizations, and we're having an organizing call on Friday, June 15th, and then we'll also be doing voter registration at our thrift stores once in the summer and then once again in the fall. So.
Excellent. So keep an eye out for lots more information about RevUp and all of our Get Out the Vote efforts. We hope that all of you are planning to engage in those efforts as well. And of course, as I mentioned, it's never too early to start preparing for the 2019 legislative session that will start on Tuesday, January 8th. It'll be really interesting to see what the legislative and executive branch dynamics are like next year with all of those open seats in the House and the governor and in the Senate as well. Of course, it's also going to be a budget year when we focus on securing new funding for programs and services. So we're already in the process of putting together something new for the ARC called a policy platform. Essentially, this policy platform will take a look at our position statements and highlight some of the key areas where we really want to see structural reform and overarching systems change that will result in increased inclusion and integration of people with disabilities, whether that's housing, transportation, employment, etc. And that policy platform will really be a kind of a guiding document for our legislative agenda that will have specific proposals that we'll be advocating for during the session. And we really want to know what your priorities are as we develop that agenda. So if you have any ideas, if there are problems or solutions that you'd like to propose, please don't hesitate to reach out to Jean and me. We'd love to hear from folks about what your ideas are. We'll also be assessing what other coalition partners' priorities are, how we can integrate those into our legislative agenda, but overall really seeking areas where the ARC Minnesota can take a leadership position and make sure that we're advancing those ideal outcomes for folks with disabilities. So, Jean, during the presentation, did we see any questions come through in the chat?
Well, we actually had a technical glitch, and I'm not able to dial in as an organizer, so we can look on your screen, I believe, and see if we have any questions. And I don't. We've got one.
We've got one question. Can you explain more about which HCBS recipients will be at risk for the 7% cut effective July 1st? Thank you. Deb, I will certainly do my best to do that. Based on the way that the disability waiver rate system has been implemented, there was a process called banding, where some individuals' rates could not be adjusted up or down by a certain percentage over the course of several years. Some individuals' rates for services are still banded, so they cannot increase or decrease by more than a certain percentage. Other people's rates are not banded. And so if an individual's rate is not banded, they will be impacted by the 7% cut effective July 1st. And I know that DHS is working with providers to identify whose rates are banded or unbanded, who will feel the full impact of the 7% cut right away on July 1st. I can certainly put you in touch with some folks that are very knowledgeable about this issue, and I'd be happy to do so. I encourage you to just shoot me an email so I have your contact information, or send it to us in the private chat. And again, I'd be happy to get more information about that for you. All right, now I think I will try to figure out how to unmute your line so that anybody has a question, you can ask it with the
Where's
group.
that microphone up there?
Okay. I am trying to figure out how to unmute you all. I'm sorry that it's taking me a little bit longer than anticipated. It looks like people who called into the webinar can speak if you'd like to do so. But just wanted to put it out there as an option for folks to ask any questions at this time if you have any. All right. Well, if there are no questions, then that just concludes our webinar. And again, you'll see my contact information there. I encourage you all to reach out if there are any questions that you weren't able to ask, or if you'd like more clarification about any of the items that we discussed. And thank you so much for joining us today.